Hi, my name is Caleb. Today I'm going to suction our patient. The doctor's order says the humidifier should be on 45%. First thing is first, hand hygiene. Hi, my name is Caleb, and today I'm going to suction you. Is that okay with you? The patient says yes. I have put the bed onto a semi-collar position. I'm also checking the oxygen. It is set on a 45 humidifier, and it comes to 10 liters of 10 liters. But since it's too loud, I'm just gonna shut it off. It's too loud, I'm just gonna shut it off for the sake of the video, right? So I'll turn that off, and so before we do that, I'm going to pre-oxygenate my patient before I suction him. I'm also gonna put my gloves. Okay, so we're gonna disconnect him right here. So now what I'm going to do is, you don't need the face mask, I'll take off the face mask. Of course, this tube should come clean and from a new package. So I'll connect it right here. And we're going to turn on the oxygen to the highest level because we want our patient to have 100% O2 set. Okay. So if my patient was conscious and able to breathe by himself, I would just use the face mask. But since my patient can't do that, I'm gonna have to use this bag. Okay. So in synchrony with his breath, I'm gonna give him about 2 to 3 breaths. Okay, so I have pre-oxygenated him. I'm going to shut this off. Now I'll go ahead and suction him. Okay, so I'll suction. So the safe level for suctioning is from 80 to 120. And I'm going to set this to Okay, so I have set this to 115, and I'm going to connect this to a 10 French catheter. Of course, I wanna note that the reason why I chose 10 French catheter is because the trach is 7 millimeters, so you reduce 2 and multiply 5 by 2, and that gives you to 10 French. Okay, so you have to keep the end of it sterile. So I'm gonna make sure I don't touch that. I'm gonna insert about 5 inches. Okay, so after having done that, I did not suction as I went in. After having go for about 5 inches, I'm going to intermittently suction. So squeeze, suction for about 15 seconds, and suction as I come out as well. Okay, so after having done that, I'm going to use my glove and dispose the catheter. Now I'm going to use sterile water to suction the tube and clean it. Of course, we don't have sterile water now, but in practice we will do that. Okay, so after having done that, I'm going to have to hook up my patient, hook his oxygen bag.
I have the correct catheter size. Suction cylinder trach is a size 7, so we're going to minus 2 from 7 to 5, and we're going to times 2 which is 10. So now we're going to pre-oxygenate them, so the oxygen is already hooked up, and it's running 40% per minute.
All right, so
So we're going to
now my partner is gonna come and take my
So I'm
take
just
the
gonna
phone
set
here.
this. Of course, thank you. I'm gonna set this back and put his oxygen back, which is 10 liters of millimercury. Okay, now his oxygen is running and my patient is comfortable. Now I'm gonna go take care of the camera, and my patient is going to continue this check here.
Alright, so I'm Alex. I'm going to be taking care of you today, doing the change of the inner cannula. We're going to change the dressing, assess the site, and he's okay with that. So to start off, I'm going to do hand hygiene. He's in the right position there. And we check the doctor's orders, as my partner has said. Raise the bed here a little bit. So I'm going to do hand hygiene, and then to have to take this off. So we're just going to go like that, put that around the side of his head there, because my partner already suctioned and everything, so he's good to go. So I'll do hand hygiene again. I'm going to make sure I have all my supplies, so we're going to need the inner disposable cannula, and we've checked we do have the right size, 7mm. And I've got some Q-tips here as well, and our drain sponge. So to start, I'm going to open our tray. Maintaining sterility of the tray. Just like so. This is the garbage bag. You can set that up over here. We won't need this, so I can go in the garbage. And now I'm going to just move my tweezers. Move the tweezers out into the 1-inch border so I can successfully grab them. Put that there. So now I'm going to add my normal saline. Making sure not to have any splashing. And I'm going to open up my drain sponge. Add that to my field, throw that out. I'm going to open up our Q-tip package, wing it back. I'm going to pull those out. I'm going to put them right there where I can easily grab them. There we go. And we'll open up our disposable inner cannula, wing that back, making sure to maintain sterility. We'll leave it there, ready for us to go. So next up, I'm going to do hand hygiene again. I'm going to put on my clean gloves. And then I'm going to make sure not to turn my back fully to the sterile field. I'm going to tell the patient that we're going to be removing their inner cannula now. So I'm going to pull that out like so. I can wrap it in the glove and we'll throw these gloves out. I'm going to do hand hygiene again. Put on a new pair of gloves. Okay, so I've got my inner cannula here. I'm going to only touch the outer edge of it. We're using clean technique here. So I've got just the outer piece of it, and we're going to go in on an angle like so. And there, that's in. So next, I'm going to, now that the clean cannula is in, I'm going to remove our patient's old drain dressing here. Take that off. I'm going to take my gloves off. And I'm going to make sure to assess the stoma site there so you don't see any redness or swelling, no signs of infection. I'll assess that again after we clean it. So I'm going to go ahead and do hand hygiene again. And put on another pair of gloves. Alright, our gloves are on. So to start now, I'm going to start with our Q-tips. So we'll start with the first one. I'm going to put some normal saline on it, and we're going to gently, we're going to start from cleanest to dirtiest. So I'm going to support the trach there and go right next to the stoma site in a semicircle, one swipe per wipe. We'll throw that out, and I'll dip that in normal saline again, and we'll go from the top, cleanest to dirtiest around the stoma site. Throw that out. Now I'm going to use my tweezers. Get those out of there. I'm going to use 2x2s. And make a rosette. Put some normal saline on that, squeeze it out, goes back down. We're gonna go from the bottom again. So I'll support, do a semicircle, one swipe per wipe, throw that out. Get another one. get that in normal saline, squeeze a bit out. I'll go from the top, one swipe around, like so, throw that out. All right, so I'm confident that we got enough clean there. Now I'm going to dry. It looks like there's no extra crust or anything on the trach tube as well. So we'll dry from the bottom, going around like that, semicircle, throw that out. And then we'll go from the top, semicircle, around like so, and throw that out. So now our stoma site is clean and dry. I have assessed it, and there is in fact no infections, and the patient isn't complaining. So we're going to now go ahead and put on our new drain sponge. So in order to do that, I'm going to fold it back. And also noting, I would start with new stuff if any of this was contaminated or sterility was compromised. So I folded it like so. I'm going to make sure that the centerpiece that touches the stoma doesn't get contaminated at all. I'm going to go down and kind of push it up a bit. And I could use Q-tips as well to kind of get it up there, just to make sure that we don't poke his neck with the metal forceps. Okay, so now I can grab the edges with my fingers and make sure that I don't contaminate the part that's going to be next to the stoma. Okay, so we've replaced the dressing there. Next, we're not going to be changing the trach ties today. So next, I'm going to then put back his oxygen. Put that back on. Put that in. We'll make sure that the oxygen is set at the level that the provider ordered, which is the 45, with the cold pot there, and everything is running properly. I'll make sure to put the bed to the lowest position and the call bells within reach. I'll clean up all the garbage here and ask the patient if they need anything else. If they're all good, we'll document on everything that we did. Caleb would document his part, and I'm documenting my procedure there. And that's it.
Very good.